From Wish TV and Community Health Network, this is a Health Spotlight Town Hall Special.
Good evening to you and welcome to this Health Spotlight special. For the next hour, we're going to be talking about health issues in Central Indiana with some of the state's top medical experts.
Yeah, so it's part of our continued commitment with Community Health Network to go beyond the headlines and give you full answers to medical questions for you and your family. So over the next 60 minutes, we want to talk about a number of issues, including infant mortality and mental health for children and teenagers.
We'll talk with Marion County Health Department Director Dr. Virginia Kane and Wish TV medical expert and former Surgeon General Dr. Jerome Adams. We also have our community health team members standing by to answer some questions live, but let's go ahead and start with the dramatic developments in COVID-19 over the past several weeks.
All right, so there have been significant changes since our last special in December. Indiana has ended its COVID-19 public health emergency, and essentially all COVID-19 restrictions have been lifted. The state now has the fewest COVID hospitalizations since it began keeping track 2 years ago. And the state just started offering second booster shots to anyone over the age of 50 and patients at high risk. But does that mean that the threat for COVID-19 is over? Wish TV's medical reporter, Dr. Mary Gillis, is with Dr. Jerome Adams to ask that question.
Great to be here. We've got good news to talk about.
We do. We have a lot of good stuff. So first I want to kick this off with what's going on now with COVID. So where are we? What can we expect? Can we expect more surges, especially with this emergence of Deltacron?
Well, where are we? We are in a lull right now, and that's a good thing. We're seeing cases down to near record lows when you look back over the last 2 years, both in Indiana and nationwide. Hospitalizations have come down significantly. Deaths, again, and that's the ultimate metric that we really care about, are again at a nadir. So that is a good thing. The challenge is that we see this happen over and over again. Cases get better, people think the pandemic's over, and they let their guard down. And so what we're really trying to help people understand from a public health point of view is that we are going to see more surges. I'm confident that we are because we don't have enough of the world vaccinated yet to prevent new variants from being generated. And if we don't take the steps right now that are going to be necessary to mitigate the next surge, then it could be another surge that's just as bad as the previous two we've seen with Omicron and with Delta.
Well, the thing is, it's all about prevention here, and I'm just wondering if maybe some of these restrictions have been loosened a little bit too much. But again, we also want our freedom. We want to come back into. And then I'm also thinking that maybe over this past 2 years, we've been able to establish a pattern. So maybe this spring, summer surge, we could imagine this is coming up. But we don't have a crystal ball. We don't know just yet about any of those things. But I think it is very important to say, COVID's not over. I had someone come up to me and they said, "Is COVID over?" Well, what do you mean by that?
Exactly.
So it's going to be something that's going to be here, right? Viruses are very difficult to eradicate.
Well, exactly. The zero COVID strategy, the COVID is going to be gone hope, is one that I think we need to just push out the window. We're going to be living with this virus for a while, but something that you and I both emphasize to people all the time is that we have more tools than ever before to be able to live with it with minimal harm to most populations. We have vaccines and boosters. We now have better masks available for people who are particularly vulnerable. We really still need to up our ventilation game because we know that the better ventilation we have, the less likely a respiratory virus is going to be to spread in a closed room. But we know what we need to do now. We just need to implement those strategies on an individual level and on a larger institutional and governmental level moving forward. You and I have talked frequently about testing. One of the things that frustrates me is we still don't seem to have a testing strategy. Up to 50% of the cases of COVID are spread asymptomatically. But right now, our testing strategy still is wait until you get a fever, wait until you get a cough and get sick, and then you go in and get tested. Well, that's not allowing us to catch the people who may be spreading asymptomatically, and it's also, unfortunately, not allowing us to catch people early enough to get them promptly on oral antivirals. So tools are there. We need to figure out how we better get those tools to people at the community level and get them to embrace them.
we talked about the possible fourth shot right now. The two different strategies, Moderna, they're asking for all adults, and this is just based on sort of surveillance data, from what I understand. There wasn't a specific study that they did, and then Pfizer did a specific study, what they were seeing in Israel, and they said over 65. What do you think about both of their strategies?
I think it's good that we have two different strategies being deployed, because one of the real challenges about this pandemic is that we've been building the plane as we're flying it. I want people to understand, once we saw there was efficacy data for the vaccines, we could not afford to wait. And so in the best of scenarios, we would have taken several years, not just to figure out if these vaccines were safe. We knew for certain that they were safe, not to find out if they were effective enough, but to find out what's the ideal dosing strategy. So we're still figuring out, should you get dose 2 at 30 days? Should you get dose 2 at 60 days? Should you get 3 doses? And that's still being figured out. So I actually like the fact that you have two different strategies from two different companies. And overall, we know that immunity does wane. And it does wane in everyone, but we know that the people who are most at risk are going to be people over 65. So Pfizer's strategy is to say, okay, as we're getting this figured out, let's make sure we're protecting the people who most need it or who most will be harmed by waning immunity. Whereas Moderna's strategy is saying, look, immunity wanes in everybody, let's protect everybody. And ultimately, I don't think either one of those is a bad way to go, but we'll get to see the two play out. What I say to people is that I actually think we should count 3 doses as fully vaccinated. I've said that consistently. That should be fully vaccinated. It's what we do for many other vaccines. And if we say that's fully vaccinated, then we can say if you're in an at-risk group and you want to get a booster, then you can get a booster, whether you're over 65 or whether you're immunocompromised. That's what I personally think should happen. And then I think you fall into a routine like flu where you get a fall update. And if we do that, then I think the public will accept it and embrace it better, as opposed to us chasing after variant after variant after variant. But you still have that option for people, because on the other side, there are a lot of people out there who are frustrated because they can't get a 4th dose. And so there are people out there who want a 4th dose, and there are people out there who say, leave me alone until the fall. We need a strategy that accommodates both.
If it's okay with you, I'd like to move on to kids.
Yes.
Kids, oh my gosh, these poor kids, entering life into a pandemic. We're in long COVID in kids. Are we seeing instances of long COVID in kids? And I also want to circle back to adults too. And if so, what is being done about it?
Well, we're seeing more and more evidence of long COVID in kids and in adults. Up to 1 out of 3 people who've actually been diagnosed with COVID, even if they have mild and sometimes even asymptomatic cases of COVID, are developing symptoms further on down the road that are suggestive of long COVID. Now, the question is, what is long COVID? This is another ship that we're building as we've already taken it out.
Because this is a new term. This
exactly.
isn't a medical term just yet. It's something that we're still sort of trying to make sense of and right.
Exactly. No, exactly. And so we've seen, for instance, in adults, that people who've been diagnosed even with mild cases of COVID have a higher incidence of cardiac events further on down the road, weeks to months down the road. We've seen that people who've been diagnosed with COVID have cognitive issues, so they're not able to complete tests that require your brain further on down the road. And there were studies that looked at MRIs of people who'd had COVID both before and after, and they saw that the gray matter in your brain shrunk after you've been diagnosed with COVID. So this is something that really concerns me. With Zika, we actually had to establish a Zika registry so that we could follow people out for a disease where you might not see the negative outcomes for years down the road. What we need to do, and there's a bill before Congress right now, is establish a registry so that we can follow people who've been diagnosed with COVID. But I think the lesson for policymakers is we need to do the research, and we need to continue to fund and do the research so we understand what's going on, which means we need to collect the data through the health department and through hospitals, which means we need to have a testing strategy so we know who tests positive and who doesn't. But the lesson for people out there is, yes, less than 1% who get COVID die from it, but a much greater percentage of people who are diagnosed with COVID suffer harm from it, and we're still learning about the harm that can come from getting diagnosed with COVID, particularly in terms of long COVID.
want to welcome in Dr. Virginia Kane with the Marion County Health Department. Dr. Kane, you know, we always love when you get a chance to come and visit with us. You've been doing so many things out in the community, but let's go ahead and start with the same question that we asked Dr. Adams. You know, where do you think and believe that we are right now in this fight against COVID, and is COVID over?
Well, you know, I'm very optimistic that we may be near the end of this pandemic and we're becoming endemic, as they say, where it'll always be around, but I don't think we'll see that big major surge like we saw in December, January, and February when our hospital systems were so overwhelmed.
We had so many weeks there where we were just talking about new variant after new variant. At least it seemed like it. Are you worried about any more variants or additional surges?
Well, you know, we have this new variant from the Omicron variant. It's the BA2. We call it the Steph variant. It appears to be a little bit more contagious than the Omicron variant, but we don't seem to see as much severe illnesses associated with this particular variant. And then we have sort of like a combination variant with the Delta Omicron variant that we're trying to keep our close eyes on.
We see this new push to start watching hospitalizations again. We kept kind of telling people every day what those look like. Seemed like we tapered away from doing that. Do you think there's still an importance in showing that?
Yeah, so it's definitely an importance in showing that because, you know, our old criteria that we had, we looked at the positivity rate of our community, the number of people who are positive based on the total population of the community. But what's happened is that we have so many of these home kit tests now where people can test themselves, but they don't always report it. And it's not reportable. So the accuracy of the positivity may not be as great. So then we have to look for other measures, such as the number of hospitalizations, the number of COVID cases in a hospital setting, that what percentage of their beds are they utilizing? What percentage of their intensive care unit beds are they utilizing? So it gives us a sense of the severity of the illness and the transmission in the community. So I think those are really important factors. And if you ask me about it, I'll give you some numbers related to that for our community.
Sure. You know, I think about these at-home tests. We all waited so long to be able to have access to them. Are they making it a little harder to track the virus like we were before?
So I think it does make it harder to track the virus, and that's why CDC has come up with a number of national experts with the different criteria of looking at the number of hospitalizations we're seeing in a day, the number of cases that are presented and diagnosed in a day, but also, you know, how many of our intensive care beds are we utilizing? So are we overwhelming our hospital systems where we can't manage the spread of the infection because of so much significant disease?
Dr. Kane, you have become one of my favorite science teachers.
Well, I've always said you are very smart and astute as a reporter. I've always appreciated that about you.
I appreciate that. So explain to me, because we use these terms all the time, what's the difference between a pandemic and an endemic?
So a pandemic means that you're having a lot of infections and it's occurring globally. And it's having such outbreaks occurring in multiple areas. Endemic means that you've now seen this major surge of cases. It is kind of quieting down. You're no longer seeing large number of cases, but it is to the point where you were not able to eradicate that infection completely. So you continue to have a subset of infections, and it becomes what we call endemic. It's sort of like our influenza, the flu. We will have seasonal flu every year, and so we will require vaccinations in order to prevent new onset of cases with influenza. And so we believe that this will probably happen as well with the COVID-19.
And a good conversation there. Let's welcome in now Dr. Robin Ledyard, the Chief Medical Officer for Community Health Network. Doctor, good to see you. Thank you for joining us.
Thank you.
I want to get your take on the questions that we asked Dr. Adams and Dr. Kane. Have we made it through the worst of COVID-19 at this point, in your medical opinion?
It seems like it. You know, here, as Dr. Kane, I think, was pointing out, even this new variant, this BA2, is more transmissible. So, but what we're seeing is milder cases. That actually is the history of new viruses like this. It's kind of, when you read about it, that's what you wanted. You wanted something like a new virus that would transmit really fast so people could develop immunity but not get as sick. And that was one of the benefits too of the vaccine, right? So even with Omicron, as we tried to educate the public, if you were vaccinated and boosted and you got Omicron, you would not end up getting hospitalized or, worse yet, die. And so we had, as Dr. Adams said, protective measures. We have protective measures now as this virus continues to mutate, spin, hopefully become less severe when you get it, either because you have immunity already or you're vaccinated. That is a good thing. So I'm very hopeful that we are on a downward slide.
Right, fingers crossed, right? So you mentioned the booster shot.
Yeah.
In your opinion, when is the best time to get the second shot?
Right. The second, you mean the second
round of the booster.
Second.
Right, yeah. The new one, right.
Thank you for clarifying. Probably about 4 months. And you know, the data is, there's a couple studies. Some of the folks in the FDA has come out and said if you're over 50, consider talking to your doctor about getting a second booster. The better data people will say is to wait till you're 65. Probably doesn't matter, right? And then I people have asked me too, should I wait and see if we're going to get another surge? And again, you know, the kind of one analogy I said, that's like waiting to see, is the stock market going to change?
Sure.
Why wait? If you are older or you have chronic conditions, get the second booster. The benefit outweighs the harm.
Yeah. We're on spring break right now. A lot of folks heading out of town, visiting family, visiting friends. We're also going to have Easter coming up.
Right.
What is your recommendation to them when it comes to gathering with people? Is it the same as it was, say, 2 years ago, or can we be a little bit more lenient?
Right now, the prevalence is really, really low. As Dr. Kane said, you know, we don't get all the tests, but what we do know is that the prevalence that we do see is like 1 to 2%. So not very many people, even with symptoms, seem to have COVID.
Right.
We're not seeing people in the hospital. So what that tells me is that we do not have an active viral spreading right now. So I think it's safe.
Yeah.
I do. It's much, much safer if everyone's vaccinated and boosted. I must always emphasize that. But, you know, outdoors is always safer. But I think if you know your family, you know the people that you're gathering with, I think we've got to be able to live our lives, and as we've said, know that COVID may be moving to that endemic. It may be too early to use that word, but I think we're all very hopeful.
Painting a pretty positive picture here tonight, Doctor. We appreciate that.
I know, I haven't always done that.
Well, it's good. It's a good thing, I think, for a lot of folks at home. All right, you're going to hang out with us for the next hour. We appreciate you taking some time. Coming up here on the show, we want to talk about your children and COVID and some of the lingering effects from the illness in kids. That's next on this Health Spotlight special.
You're watching Wish TV, Indiana's only statewide TV news network.
All right, let's welcome back Dr. Robin Ledyard, Medical Director for Community Health Network, and Jenny Volker, Behavioral Specialist. But you know what? Before we do that, let's go ahead and welcome you back to this Health Spotlight. We've been so excited to talk about different things with different experts. Now, we do want to talk about COVID and children. What impact has all of this had on our youngest Hoosiers? We'll check back in with Dr. Mary Gillis and Dr. Jerome Adams.
You know, I've heard many doctors tell me that kids are resilient and they adapt well in terms of this pandemic, or hoping that as we come out of this, social, emotionally, and their brain development. But I don't know, how has the pandemic affected kids in these ways?
Well, kids are resilient. So we need to understand that it's not the end of the world for these kids because they've gone through a pandemic. And we don't want to create an environment where they're hearing that it's the end of the world and that they're going to be permanently damaged because of the pandemic. That said, we have children all over the spectrum, and some have emotional problems, some have disabilities, some have educational issues baseline, and we know that when you're separated from your support systems, that can make it worse. So there are some kids who did really well with homeschool. Some kids did terribly. I have 3 kids, and they're along that spectrum. One did really well, one did not so well, and one did okay. We know that there are kids who actually did better with the lack of socialization because they were being bullied at school. So their mental health improved. That happened for some people. For other kids, we know their mental health substantially went in the wrong direction because they needed that socialization. So I think the lesson there is that every kid is different. Kids are resilient, but that doesn't mean as adults we should turn a blind eye to their needs, particularly those who are starting from a deficit or who develop new deficits throughout the pandemic. And we need to have programs in place to recognize who's having mental health issues, who's having an educational deficit, and how can we make up those deficits.
Talking to teachers, and I'm just going back to the education and seeing that, or learning that kids are behind in their education. How do you teach a child to read? It's like apple. You know, when the teacher has the mask on, the kids have the mask on. I don't know. Just a thought. You know that.
No, it is. You're right.
They're paying a price here.
They are paying a price, and they're paying a price again because adults in many cases say that it's my right not to do anything to slow the spread of COVID, and so that creates an environment where you have uncontrolled spread in the midst of a surge, and then the kids end up paying the price. I absolutely think that kids shouldn't be wearing masks and shouldn't have that responsibility put on them, but it happens when we don't step up. And so I really want us to focus on learning the lessons from the past 2 years as adults, making sure we're getting tested, making sure we're getting treated if we do test positive, because that can shorten the window in which we're infectious. Making sure that if we are in a surge, that we're willing to take appropriate measures to protect ourselves, including wearing a mask if that's warranted or recommended by public health experts, and making sure you're getting your vaccine and your booster. If we did these things, because remember, herd immunity is about everybody. It's not just about adults, it's about everybody. So if you lower the number of kids who you want to vaccinate or mask, then you need to increase the number of adults that you need to vaccinate or mask in order to have the same impact. That's just math. And so the problem is the math hasn't been in our favor in the United States relative to other countries because fewer adults are taking these measures, which means that the onus has been put on children. And that's not fair to kids. It's not fair to kids.
All great points being made there. Let's go ahead and welcome back Dr. Robin Ledyard, Medical Director for Community Health Network. Also, we have Jenny Volker. Thank you so much. You're behavioral specialist at Community Health. Dr. Ledyard, have you been surprised at all at what you've been seeing as far as any COVID symptoms that we've been seeing in our kiddos?
No, not too much. You know, again, luckily, as Dr. Adams stated, kids do get COVID for the most part very mildly. Not that some kids can't get really sick from it. And, you know, I think one of the things that was talked about earlier that we always had to remember is that long haul, because long haul seems to happen, again, whether you're really sick or asymptomatic, and it can happen in adults and children. And so we are seeing that more. So you still don't want your child to get COVID. Better to get them vaccinated, try to prevent it. But I think kids, you know, again, it's great that the virus was more mild in kids. You know, at the end of the day, it still ended up being age that was related to severity and death, and then some of the comorbidities.
Even after the infection, you haven't seen anything that's been too troubling to you overall?
No, I haven't, not in terms of physical. And again, you know, with my role as Chief Medical Officer, I know that some of our pediatricians are seeing some kids with some symptoms, but yeah, I have not seen the physical part. I'll let Jenny speak to the mental part. She's my specialist with me.
Well, a lot of conversation about that. Jenny, we've heard about COVID fog in adults. Is that the same in children as well?
I have not heard or seen that in children, but I feel like that might be more of a medical piece.
Okay.
I do think that emotional strain can certainly impact our functioning, our decision making, so it can look like that same fog.
Are you worried about any education delays or, kids being behind because of remote learning over 2 years? I mean, some kids, they don't even know the difference. This is how they've been introduced to learning.
Yeah.
So I don't know that we'll know the effects for a while. Kids learn in so many different ways. So some thrive in remote learning, but the majority, they need that face-to-face, especially young children. They need that teacher right there with them, hands-on learning, because they learn in so many different ways.
In regards to face-to-face, a lot of talk has been made over the years about the masks. Is that overblown, or are those concerns justified?
Well, as Dr. Adams talked about, kids are amazingly resilient. So although the bottom half of our face is so important for learning social cues, I think kids will tune into our eyes, tune into the rest of the body. So I think that they will make the shift. Now, hopefully we'll just make the shift back because kids are so incredibly resilient.
Dr. Ledyard, are there different conversations that parents should now be having with their pediatrician about going back to those normal visits or checkups or, really anything after the pandemic? I feel like everybody's on edge as if they're going to miss something.
Yeah, and yes, it's definitely time to get back to normalcy. And I know a lot of our pediatricians actually were very proactive, even during some of the surges, reaching out, checking in, saying it's safe. If, don't get behind, let's keep up on your preventative health care. And, we'll mask in the office. And so we really wanted to continue that health care because I do think what we've seen kind of across even, all medical spectrum is people were nervous about coming into healthcare. Gosh, especially at the beginning. And we kind of did that to ourselves. And so people got behind on some of their chronic illnesses. Kids got behind on some of their immunizations. And again, I think as Jenny said, the effects of the pandemic we'll probably be talking about for several years. Yeah.
We're going to continue to talk about that right here on this show as well, because coming up, tackling that issue of mental health is our biggest topic here in Indiana. A new study from the CDC on just how much a toll teens have suffered because of COVID-19.
Focus on family and the community. Wish TV.
And welcome back to this Health Spotlight special. We're proud to team up once again with Community Health Network to answer your questions about the top medical issues of the day.
And we also want to spend the next few minutes talking about mental health, which is very important, and start with a new study that just was released this afternoon by the Centers for Disease Control on teen mental health. We want to show you some of the numbers right now. Okay, so this was an online survey of about 7,700 public and private high school students in 2021. It's a whole lot of students. 44% reported feeling persistently sad or hopeless during the past year. The previous number had been 37, so you see an increase there. 2/3 said they found it more difficult to complete homework. 29% said a parent or other adult at home had lost a job. And 24%, 1 out of every 4 students, said that they went hungry during the pandemic because there wasn't enough food at home. Startling numbers there.
Absolutely, no doubt about that. Dr. Robin Ledyard, Medical Director for Community Health Network, joining us once again. Jenny Volker as well, behavioral specialist. Ladies, you saw those numbers. Your thoughts? Jenny, we'll start with you.
Yeah, so it's empowering to know information. So happy to have this information. The numbers are high. Unfortunately, before the pandemic, they were starting to rise. So we're seeing them continue to go up. And yes, that will impact teen mental health ongoing.
Wow. Have we underestimated how much this time, this very weird and confusing time, has been on the health of our teens and our children?
Yeah, well, again, I do think you have to classify, like when we were talking about children, we were talking more about young children, grade school children, and as we said, they do tend to be resilient. Teens, you're talking about young adults. I mean, you really are, and so, especially with the challenges that come as you move into middle school, high school, start thinking about college, then I think it will, again, it's going to be a while before we come out of this, see the effects, and hopefully, because we have this data though, like Jenny said, we need to try to come up with actions now and react to that, offer services to our teens so that we can help them adjust.
Jenny, a big part of this conversation is kids being on computers over the past 2 years, a lot of social media use. Has it made it worse, the social media use, in your opinion?
I think it depends on how it's been used. So in some cases, yes, it's made it worse. There are things that can be said on social media that wouldn't be said face to face. That socialization that comes from interaction in person doesn't happen in social media. On the flip side, social media helps us to connect to people who may have similar interests. So for some, with excessive use, yes, it certainly can have a negative impact.
It's so accessible, right? I mean, I'm almost more accessible than I've ever wanted to be. So if I were a parent, so I think I'm the only non-parent up here just yet. But as for parents out there, yes, for parents out there, how do they figure out what's enough and what's too much when it comes to the accessibility to their kids? There's so much out there.
Yeah, go ahead, start with that, Jenny.
Yes, so, and honestly, I'm not a parent either, but I've worked with kids for almost 25 years. So,
welcome to the club. There we go.
Yes. So I think that, again, it's going to vary from child to child. And I always say that parents are the experts on their kids. So it is important to create those zones, those technology-free zones. And if parents want their kids off their phones or their computers, parents need to do the same. They need to honor those zones. So having those hours each day for just a conversation, whether that's at dinner time, whether that's at bedtime, and especially for teens, to really check in and see, how are you doing? What's going on?
Does age play a role? When it's too old to be on social media, maybe, should we be putting those parameters and restrictions on kids of a certain age?
I think it's probably more development than age, because development changes so much across the age range. So again, parents are the experts on their kids, but very young children, we know that it can change brain development to be on technology and to be on technology too much. So minimizing that is important with young children. As your child becomes a teenager though, taking away social media is not going to work. We know that. So really figuring out with your child how they make responsible choices, how they set their own limits, what they're in control of, and supporting them and talking them through that.
Let's talk about managing expectation, because it's so interesting. You know, we have those kids who are just naturally mature.
Sure.
You know, we have those. Then we have some taking a little bit longer to get there, right? How do we have different conversations with them? Because as those statistics showed us, you know, some of these parents are losing their jobs, or maybe, you know, food is an issue. So how do we have these conversations as we know that this is impacting their mental?
One, often. So asking, you know, and it's old school, but how was your day? Starting off with that, role modeling our own emotions. So adults in the lives of children can say, you know, this was the high point of my day and this was the low point of my day, and I felt really sad and frustrated. So managing the conversations frequently, it's not a one and done thing. It is an ongoing checking in. Also knowing that teens, especially, they're going to ebb and flow in how much they're going to want to talk to us. So finding other adults, other trusted individuals that they can also talk to can be really helpful.
And again, we're having this conversation because those numbers that we just showed you here at the top of the block here, moving in the wrong direction. So I guess a good question is, do we have a mental health crisis here in Indiana? Not just when it comes to kids, but when it comes to adults as well. And is it pandemic related? Doctor?
I think as Jenny said, we had a mental health crisis before the pandemic. We did. I think that we have more people who need help often than we have services to give. We see that all the time at Community Health Network. And so I think the pandemic has layered on a stressor that none of us could have imagined. And so then I think that has made a worsening of that mental health crisis. I think we still are trying to figure out how we are going to be able to service everyone, right place, right time. I mean, shows like this get information out there, and that's great. But I do think that we have a mental health crisis that has been worsened by the pandemic. I don't know if you'd agree, Jenny.
I absolutely agree.
Yeah.
Yes.
When it comes to taking ownership, because I don't know, I mean, when I was like, what, 15, 16, I don't know if I really was trying to take ownership of my health. I mean, other than being able to, you know, maybe not go to school on a test day. You know, I really wasn't thinking about it all that much.
Yeah.
Do you see more young people, even young adults, taking more ownership of their health? And what are some of the things, if so, what are some of the things that they should really be, you know, pointedly looking at as we move beyond just COVID-19?
Yeah, I think teens take ownership of their health because it's been role modeled within their family, or they have a mentor, like Jenny said. It takes a village to raise a child, and I was always happy when my child wanted to talk to other adults that I trusted and knew outside my circle of my immediate family, because they need more information than just what I have to give anyway. And so I think that children, again, like us, they have a lot of information at their disposal. So the other thing, you know, as Jenny said in those conversations, what are you looking at online? You know, what's important to you in terms of your social media? What's going on there? Really trying to check in and be aware. I know some parents that really screen that a lot. I have mixed feelings about that, because you want to have that trust as much as possible. And as long as they earn that trust, I do think those conversations are important. So I think that health mindfulness can come from role modeling and asking questions too about, you know, how they're feeling about their body and changes and what's going on.
Jenny, are we going to see positive changes now that things are starting to get back to normal when it comes to mental health?
Well, I certainly hope so. I think one of the positive changes and one of the positive impacts is we're having this conversation. So we're talking about the concern. It's not something that we're brushing under the rug. People can learn more about the resources that are out there. They can learn the warning signs and get the help that they need. So yes, I think we'll see changes, but I think, as Dr. Ledgert said, we'll see ongoing impacts for a while.
You know, Dr. Adams said something that was really important. I think you all would agree that there is a difference between mental illness and mental wellness. And when he was breaking this down, I was like, I guess I just never thought about it like that. I mean, you know, so can we talk about that? Because I think in different spaces that we're occupying, whether it be school or work or extracurricular activities, this subject is coming up more and more and more. So those entities, what should they understand in order to be able to service our kids, us, you know, at work, about the difference between mental illness and mental wellness?
I'll take a stab at it, and then I know Jenny will add as well. But you know, mental illness is diagnosable. So depression, as an example, is defined as over a period of time, certain feelings that a person can describe that tends to then begin to encroach on their ability to function, right? And so, you know, mental wellness is, you know, again, not just not having depression, but also being able to interact in the world, feel good about that, feel refreshed, feel nourished, you know, the things that we talk about that could be related to social determinants of health. So, you know, it's a spectrum, right? You can feel sad one day, but I'm not depressed. I have a reactive sadness to a situation, a TV show I watch. Sure. So we all have different feelings all the time. It becomes an illness, really, when it becomes more chronic and begins to inhibit the way you can function in society. So do you add more to that?
I couldn't have said it better, so thank you. I think when we take it the next step with mental wellness, it is that self-care. Those are the actions that we take to keep ourselves healthy. Just like we brush our teeth to keep our teeth healthy, our teeth healthy, we also do self-care to keep our bodies healthy. Well, we do self-care to keep our mental wellness as well.
Yeah, I love that.
That's a good point.
Yeah.
So many good points.
Oh, yeah.
And we'll continue with good points coming up. Making healthcare available and equitable for all people. The new push in Marion County and Central Indiana. Next.
You're watching Wish TV, Indiana's only statewide TV news network.
Welcome back to this Health Spotlight special. Wish TV proud to work with Community Health Network this year on 3 initiatives important to our entire community. We're teaming up with Community this year to use Health Spotlight to bring a renewed focus on 3 issues: fighting cancer, infant mortality, and improving diversity and equity in healthcare. We asked Dr. Jerome Adams about how the pandemic may have impacted the question of inequity.
That's what I really worry about, is you see these deficits between the haves and the have-nots are only going to get wider. And that leads into the health equity conversation. Are people getting what they need? Whether it's to get caught up on their vaccinations, or to get extra cancer screenings, or to have their mental health needs attended to, or to help them with their educational deficit that they've accumulated. We need to make sure we're identifying people and targeting interventions to help them get back to where they need to be.
I think a couple of things that we know is top of mind, especially after this past couple years, is diversity and equity in medicine. I know you're huge on this. Especially during the pandemic, we saw a bit of inequity in treatment and access to medicine, both on race and income levels, that you all really try to address. Is that still an issue at this point, and how do we fix those gaps, if you will?
Well, let me just say it's definitely an issue, and I think it's going to take a mountain of training, education, sensitivity, compassion, and a dialogue between our patients, because there are cultural differences, and they may be racial and ethnic, population, cultural issues, and you can have implicit bias and not be aware that you may be biased until someone brings that to your attention. You may not realize that you may be offending someone, or the comments that you have made makes it so that you don't even realize my situation here, and you're making professional recommendations here that doesn't have any relevance to me, and so as such, I'm not going to listen to your recommendations, and it's not a win-win situation for any of us. But I have to commend the healthcare delivery systems in the city of Indianapolis. They are taking charge. Indiana University Community Hospital, Ashkenazi Hospital, St. Francis Community hospital systems are really trying to tackle this head on. They're having dialogue with the communities, and hopefully they're putting in place a lot of training, but even you have to have some mechanisms in place. So how as a patient that I feel that I might not have been treated equally, or access to certain treatment from an equity standpoint, how am I able to get that issue before the very folks that are serving me? And how do we increase our access for patients who may not have access? And it's a learning experience. So for example, when we were doing our diagnostic testing for COVID-19, I'm patting myself on the back thinking I'm doing a fantastic job. And I was called out, rightly so, with our Latino organizations to say that I'm thinking with my 3rd grade level materials out there that I was fine, and I didn't realize the significant number of people who cannot read at all. There's a health literacy issue. And so I had to redesign my healthcare system in order to make it accessible for the people to receive the critical services that they need.
Do you think that the pandemic shined more of a recent light on this?
This pandemic highlighted how critical social determinants are health, and that's accessible and affordable housing. That's transportation, okay? That's addressing food insecurity, makes a huge difference with our health outcomes. And this pandemic highlighted those significant gaps related to that. And we've got to be better prepared in the event that something like this is going to happen again. And hey, mark my words, it's going to happen again. We had SARS back in Canada, okay? We had H1N1, and then we had Ebola virus. And so now there's another syndrome called MERS syndrome that we saw in Europe. And so we are now seeing emerging resistant pathogens that are now making a major presence globally in this world. And so we have got to be better prepared because we're just a plane ride away from different vectors that can, whether it's insects, Zika virus, for example, that can impact us.
Before I let you go, something that's near and dear to me, and I think a lot of people out there, infant mortality.
Yes.
You know, this is something that a lot of people have been thinking about as they've been trying to protect themselves, especially within the pandemic. And, you know, there's been so much good work that's been happening going into, you know, 2020 and then therefore so on. How do you regain that momentum for people to focus on infant mortality in our city?
I think it's critical that we cannot allow other major issues that have impacted our communities from just going to the wayside, because we will lose so much and all those gains and progress that we have. We don't want to have that happen. And that's such a critical, important health issues for our communities, whether it's infant mortality, maternal morbidity and mortality, HIV infections, cancer awareness. You know, we've seen a significant increase in our cancer incidence because people weren't able to necessarily access their health care. And we had telemedicine, and that's great, but if you didn't and couldn't have internet access, how do you do telemedicine? And so look to see some exciting things. We've been in a lot of dialogue, Dr. Christina Botts and myself, who's our state health commissioner. So look to see some special announcements that we both are going to make from a local level and a state level that's going to address infant mortality and maternal mortality. So some great things we're gonna see this summer. And we've got some wonderful community activists out there, advocates, trying to make sure that we're designing a system that people will feel comfortable with, and they will go and get their right prenatal care. And we have another special announcement, but I don't have the right to announce it. But coming soon, you should hear something in about a month or so. That's some incredible work that's going to be offered by some other agencies related to infant mortality.
Last question for you. If you could talk to Dr. Kane in March of 2020, with the knowledge of what Dr. Kane knows now in March of 2022, what would you have told yourself?
Wow. I just think I couldn't have envisioned that we would have a epidemic where we had to stay in shelter. We had so many people impacted. We had a significant number of businesses that resulted in being closed, so many events that didn't get held, and just the overwhelming of our healthcare personnel and the incredible challenges and I have to say, this community, under the leadership of our Mayor Hotsett, we stepped up to the plate. People came out. They offered food for the food insecurity. They reached out their hands to the homeless. Civic organizations doing things that you never heard about, doing community outreach, doing that additional staff, and I'm just so proud of my healthcare professional colleagues and all the work that we've done. But hey, social service agencies, those organizations that address social determinants of health, Gleason's, Gleaners, and so many other different entities. I'm just proud of being in the city of Indianapolis. And listen, when you look at us, based on our cases per 100,000 population, we are looking better than the city of Chicago, city of Columbus, Ohio, Detroit, Milwaukee, Louisville, Lexington, Cleveland. Hey, we know how to put on a good show for infection control because we have some of the finest hospital systems, the finest healthcare professionals, and a city government that knows how to work very effectively with each other. But I really have to pat you guys on the back because it's so important. We got to get the message out, and we got to get it out in a language where it's simple, very understandable, and keeping us up to date. The social media and what you guys have brought to the table with your incredible creative communication outlet, I can't thank you guys enough. So seriously,
Thank
okay?
you. Thank you so much. I hope you actually got a chance to enjoy March Madness this year.
Yes, I did, and I don't want to get anybody mad at me, but my team is in the Final Four, okay? So I can't say who that is because somebody might try to beat me up on my way out to the door. But we've got an incredible 4 teams for the Final Four NCAA for the men's and the women's. So it's just going to be exciting, especially when my team wins, and then I'll tell you who that is.
I guess we know whose bracket is not busted. Dr. Kane, thank you so much for taking time.
Thank you for having me. Appreciate it. Thanks so much.
Dr. Kane, a true Indianapolis treasure right there. One final thought from our guest here tonight. We appreciate you both being here. Doctor, we'll start with you.
Well, as I said, I am hopeful. I think people know what to do to take care of themselves. You know, get vaccinated. It's not too late. Wear your mask. Wash your hands. But take care of yourselves. Let's keep moving forward out of this pandemic.
I like it. Jenny?
Social connection builds mental wellness, and if you're struggling, seek help.
We're so excited to be teaming up with Community Health once again. We look forward to having these conversations throughout the year. Thank you so much for being here tonight. Thank you at home for watching us. We'll be back here tonight at 10/11, always online at wishtv.com. Stay healthy, stay safe.